Visual description: 3 figures holding the AUCD globe logo. Text: Association of University Centers on Disabilities, Plenary Day 2. Hashtag AUCD2020, Achieving Equity, Leading the Way in the Next Decade.
Good morning, everyone, and welcome to Day 2 of the AUCD 2020 virtual conference. I hope you found Day 1 to be both interesting and enlightening, and we're excited to start today with a dynamic plenary, followed by concurrent sessions and posters, and ending with our awards ceremony. Be sure to join us tomorrow for the closing plenary, where we'll hear from AUCD's Public Policy Director, Rylan Rogers, and members of Congress. Don't forget that virtual live council meetings will take place tomorrow afternoon to close out the conference. I'm now pleased to introduce our lead presenter and facilitator of today's plenary, Brittany Wilson. Brittany is a civil rights attorney, advocate, and writer from Brooklyn, New York. As staff attorney for the National Center for Law and Economic Justice, Brittany focuses on issues of racial justice and disability rights. Her previous work includes roles at the Center for Constitutional Rights and the American Civil Liberties Union. Brittany is especially committed to advocacy on behalf of people of color and people with disabilities, and brings her years of work and unique perspective to our discussions today. After we hear from Brittany, she will be joined by AUCD Board President-elect and Conference Chair, Tawara Good. The two of them will then moderate panelists of incredible disability leaders, practitioners, researchers, and family members, addressing issues of equity from very different perspectives. I'm grateful for Brittany's perspective and welcome her leadership on this important subject. Thank you, Brittany, for your time and participation in today's plenary.
Thank you so much for that wonderful introduction, John. I'm really excited to be here with everyone. When AUCD first reached out to me to be part of its presentation on equity, I have to admit, I was a little bit skeptical because my first thought was, what in the world is equity? It's a very vague term. I'm a civil rights lawyer. I tend to like my terms to be defined. And I also know the tendency to use words like diversity, inclusion, and equity to elicit positive feelings about the world and social justice without actually getting to the crux of what we really need to be doing to progress as a society. But as I continue to engage in discussions with members of AUCD and to partake in preparation for this discussion, I became excited about the possibility of taking part in helping to define what equity looks like or should look like in a disability space. Just to give you some personal background on me, as you learned from my introduction, I'm a civil rights attorney. I always say that the law for me wasn't a career choice. If I had my choice, I would be somewhere having written 10 books by now. I'm a creative writer, I'm a performer, but the law was something that I felt that I had to do in order to help me navigate my life as a Black disabled woman with cerebral palsy. I wanted to learn how to advocate on behalf of myself and others, the way that I grew up watching people advocate for me. And interestingly, in the course of doing this social justice work, I've learned that the reasons that I went into this work aren't actually the way that it plays out in everyday life. Everyone didn't go into social justice work or even the law, of course not the law period, to save the world, so to speak. And I found myself in doing social justice work, often I was the only one in these spaces who either was disabled or who thought about issues affecting people with disabilities. So I was always the person saying, and people with disabilities, and people with disabilities. And then in disability rights spaces, I would have to advocate for people of color with disabilities and the unique experiences that we face as people with multiply marginalized identities. So for me, equity is realizing that disability is a social justice issue and that the experiences of people of color with disabilities are different and distinct from those of other people with disabilities. That to live in this country and to live in this society and not talk about the multiple ways that people's identities affect the experiences that they have, whether we're talking about race, gender, sexual identity, class, is to not do justice in the way that we should. It's recognizing that I always use this cliche, but the image of people standing behind a fence and giving everyone one box to stand on so that they can see over the fence is not going to work for everyone because people are different heights. Some people are not going to be able to stand on the box. Some people are going to need other types of assistance. But equity to me is giving people what it is they need to succeed, not giving everyone the same thing. It's not equality. It's doing what needs to be done so that everyone can survive and everyone can thrive in our society. And so I'm interested in hearing what our panelists have to say about what equity means to them. And I'm looking forward to learning from you all as well as we continue throughout this conference. Thank you so much. And with that, I'm pleased to move into our panel of the plenary, where I'll be joined by Tawara Good, AUCD's president-elect and this year's conference chair. Thank you.
Visual description: AUCD conference logo, 3 figures holding the AUCD globe logo. Text: Achieving equity, leading the way in the next decade. Hashtag AUCD2020 Tuesday plenary. Leading change to achieve equity. Conversations we need to have. Visual description: Smiling Black woman with chin-length black hair in twists, brown eyes. She is wearing a red sweater and large necklace. Text: Tawara Good, Director, National Center for Cultural Competence, NCCC at GUCCHD. Visual description: Smiling Black woman with short black hair in twists. She's wearing glasses and a gray blazer. Text: Brittany Wilson, Staff Attorney, the National Center for Law and Economic Justice, NCLEJ. Visual description: Smiling white woman with short brown hair. She's wearing glasses, a tan sweater, and a multicolored scarf. Text: Joan Beasley, Director, Center for START Services. Visual description: White woman with short gray hair and blue-green eyes. She is wearing a red sweater and a red and yellow necklace. Text: Joan Christopher, Director, Community Service, GUCCHD. Visual description: Black woman with black hair that is tied up. She is wearing glasses, a black and white blouse, green earrings, gold bracelets, and necklaces. Text: Letitia Doucette, Owner, Catalyst Consulting. Visual description: Smiling white woman with shoulder-length, dirty blonde hair. She's wearing glasses, a blue blazer, and a black necklace. Text: Georgina Peacock, Director, Division of Human Development and Disability at NCBDDD. Visual description: Smiling Latino man with short black hair. He is wearing glasses, a black jacket, and a red button-down shirt. He is standing next to a sign that reads, Dreamer's Son, Bienvenidos aquí. Hashtag Dream Act Now. Bienvenidos aquí is Spanish for welcome here. Text: Hector Manuel Ramirez, Disability Rights Advocate.
Thank you so much, Brittany, for your great presentation and the incredible insight that you gave us into equity from multiple perspectives. I'm really excited to facilitate our two panels with you today, and we continue to explore this topic. As Brittany mentioned, I'm Tuara Good. I direct the Georgetown University Center for Excellence in Developmental Disabilities that's in Washington, D.C., and I'm also the director of the Georgetown University National Center for Cultural Competence. We're so excited to present our first panel by way of answering our first question today. I'm asking our panelists to please introduce yourself briefly and to tell us from your perspective and from your lived experience, what does equity mean to you? And we will start with Lutetia Doucette.
Hello, everyone. I'm Lutetia Andre Doucette. I'm the owner of Catalyst Consulting, and equity means a lot because it is the center of my business and who it is that I am as a person. So for me, equity is about getting everyone what they need, how they need, when they need, and so that they can live their most authentic life, right? What I need is going to be different than what someone else's needs are going to be. And so when we have an equitable society, it takes into account that not everyone needs the same thing. We don't need to be treated in the same way. You know, not everyone needs and can use a set of stairs, right? And sometimes we need to put a ramp, or maybe we need to rethink how we build in the first place so that we don't have separate entrances, etc., for those who can move within a space. So equity is truly centered around eliminating the barriers that people face, as well as creating a society that allows people to be their authentic self every day, all day. And equity must also include justice. So justice is that elimination of those barriers. You cannot have equity without justice. So that's what it means to me. Thanks so much.
Thank you so much, Lutetia. Next, we will hear from Georgina Peacock, responding to the same question. Please introduce yourself and then to share with us what equity means to you.
Hi, I'm Georgina Peacock. I'm the Director for the Division of Human Development and Disability at CDC, and also a developmental behavioral pediatrician. And when I think about equity, I think equity means that people have equal opportunity and access in all parts of their life. In my case, as a developmental pediatrician and working in public health, my focus has been mostly on improving health equity, which means that people have increased access to healthcare, which involves things like physical access, as well as ensuring clear communication and other ways to optimize healthcare, with that ultimate goal for people and populations to have equivalent health outcomes. The goal is that everybody has that same opportunity to have good health outcomes. And so I think health equity means that one should engage and educate those who need it most, and make sure that people understand how and where to access the services that they need. Thanks.
Thank you so much, Georgina. We'll now hear from Joan Christopher. Please introduce yourself and share your perspective on what equity means to you and your family.
Okay, certainly. Hi, everyone. I'm so glad to be here. I'm Joan Christopher. I work also at the Georgetown University UCD, and I've worked in the District of Columbia for many years in various capacities, working with and for people with disabilities. I'm also the parent of adult twins who have disabilities, and I'm also a trained attorney. So I always think of equity from putting my attorney hat on, and that is that equity is really about fairness and about making sure that everyone has a level playing field. So of course that means that everyone is not starting at the same place. Some people have a better starting position than others. And so equity means to make sure that everyone can at least start off together. A lot of times it's confused with equality. And people think equity and equality are the same thing. And equality works fine as a concept when people are all even and starting at the same point. So what I want to do is give you a very short story about my family. I love to talk about my family, and especially about my daughter, who is an adult who has a disability. One day, years and years ago, we were all out, and my 3 children were in the back seat of my little Plymouth Reliant station wagon arguing. And we decided we would stop for lunch at Wendy's, which was a treat. We didn't do that too often. When we got into the restaurant, my daughter had a full-fledged blowout and used her motorized wheelchair to knock over a table in the restaurant. So at that point, I said, okay, folks, let's pack up, time to go. And we straightened up the table and left and got in the car. And my sons were furious with her because we didn't get that treat too often. But I explained to them, I said, if you did that in the restaurant, we would pack up and leave, and that would be your punishment. And so it's fair, it's equal. She gets that same treatment. She knows better, she knows our values, and this is what we did. So equity is very tricky. We talk about making sure that the playing field is level, and we talk about fairness, but sometimes things should be equal. And it takes a lot of discretion, and it's about the person. So thank you.
Thank you, Joan, very much. And we will now hear from Hector Ramirez, who will introduce himself and share with us his perspective on what is equity.
Thank you. Gracias. First of all, I just want to thank you all for this really fantastic opportunity, and thank you for the space you have created here. My name is Hector Ramirez. I am Apache Mexican. I'm a person with a disability. I'm autistic. I have a psychiatric disability, and I'm hard of hearing. I live here in a very tiny little place called Los Angeles in the Tangva Tongva land, which is the ancestral land of the Fernandino Tatavian band of Mission Indians. And this is an interesting question about equity. And I think as a Native person, I look at that word and I really had to kind of look at its origins. And it's primarily used in the context of law and justice. It also has a significant origin in commerce, in business. And the way that I look at it, it refers to how much something is worth. And so I think of that word, first of all, because of the way that it kind of impacts me in my life as an Indigenous person, as a person with a disability, as a person of color. I'm also two spirits. And I realized that this term is not necessarily something that really resonates with me. I think I forgot what equity was or equality was a long time ago. I'm 45 years old now. But when I think of equity, I think of it more as a term of access, as a term of restoration and balance. Oftentimes, most of us find ourselves in different environments, having less access than others, not necessarily because of what we're experiencing at that moment, but because of what we're experiencing, because of what has happened, for decades and many generations before. So there tends to be more of a temporal approach to this, especially when trying to create policies and legislation and programs to benefit, people with disabilities. And so I think the term of that equity that I think about, I think of it more as a restorative process necessary to kind of begin the work that is needed after that. I don't think we can get to equity before addressing some of the inequities that have created that environment, going back to the way Indigenous people are treated, going back to the way that women are treated. I don't think that we can just also talk about issues of race or economics without addressing those particular issues as well. And that's a significant task. So I think equity is an ongoing piece of work. So by focusing more on a restorative approach to it, as a balanced approach, I think for me and for my community is more tangible, more real, rather than something from the business world that often tends to commodify and say that something is worth more than other. So I try not to use the term equity or equality or normal. I think those are kind of dangerous words. They're part of our culture, so they're there. I treat them with respect, but I also oftentimes take opportunities like this to really convey how, some of the words that we might use can oftentimes be used in coordination with some of our values or cultures. So inequity is one of those words, like justice. Justice is very different, intersectional.
Thank you so much, Hector, and all of you for introducing yourselves and sharing with us your unique perspectives around equity. I must make an observation. I don't have to make an observation, but making an observation really about how you have spoken to equity. You've differentiated from equality. And so that I'm hearing that treating all people the same, regardless of their need, their circumstances, or ability, might be what we look at in terms of equality. But when we are speaking to equity, including the journey we need to get to ensure that there's equity for all, is providing people with different levels of support and assistance depending on their need, their circumstances, or abilities. So with that said, I am going to turn this over to Brittany.
Thank you, Tawara. And I'd like to ask our panelists to talk about how they've experienced inequities, both personally and professionally. Let's start with Hector.
Thank you. That's kind of a personal, strong question. I was diagnosed when I was 4 as having autism, and I'm Native American, and so I think inequity for me kind of initiated back then. And for my family, I was removed from my family at an early age because I had gotten that diagnosis, and because I was Native, and I spent many years in an institution, and so that for me was kind of my understanding of perhaps what equity might have been like as a person who's disabled and Native. I definitely felt punished, removed, and unwanted, even though my family wanted me, and they were not the ones that did that. So it's definitely something that is part of my makeup. I think I've fought it, or really tried to work against inequality just by myself, trying to be a model to my family, my community, helping to elevate those who experience the same time of hardships that I have, especially in the disability community and the Native community, of Latinx communities, to really highlight that particular side of society. I think it's kind of interesting that as somebody who was institutionalized earlier on, because society kind of deemed unworthy, I ended up going to become the first person in my family graduating from high school, because it was mandated by law. But I was also the first person in my family to complete college, and I'm the only one in my family to have a PhD. And that's one of the ways that I also combat, inequity. Oftentimes people look at people with disabilities like myself and are quick to judge our abilities. And more often than not, people are really taken aback when I realize that I sometimes am the one that has the highest, science terminal degree in the room. And it really shatters perceptions. And it's been kind of an interesting approach, at least in my experience.
Thank you for sharing that, Hector. Now, Joan, tell us about how you've experienced inequities both personally and professionally.
Okay. So what I'd like to do again is to talk a little about my daughter who um, you can look at and see she has a disability. She uses a wheelchair. Her speech is not always easy to understand. So one thing that I learned early on is that when she is treated as though she's not there very often, which I've seen happen with a lot of people who have visible disabilities. Um, and so as I've gotten older and wiser, I'm very quick to tell people not to speak to me when it is something that has to do with her, and to speak to her directly, because I recognize that they are marginalizing her when they don't include her in a conversation about herself. So that has always been an inequity that has irritated me to no end. Um, a lot of times if someone doesn't understand what she's saying because they don't know her and they're not used to her, I will demonstrate for them and ask her to repeat what she's saying or say it in a different way. And it all has to do with your attitude and how you present it to her. And she's very happy with that. She understands that. Um, I've also had to explain to her brothers that because growing up, they would say, well, you are always spending time with her, and how come she gets so much, and blah, blah, blah. And once again, they learned early on the concept of equity. I said she gets it because she needs it. It's just like with someone who needs help with a particular thing, you help them, and the person next to them might not need what they need or might not need that support. And so you save your energy for the person who does need it. Um, so that has been how it's impacted me personally the most. Professionally, when she was younger, she rode the public school bus and 3 days out of 5, the school bus was late and it made me late to work. So I finally requested of the director of my agency to give me an accommodation because of her, because I was getting to work late and everyone else was already there. And I needed it for her accommodation because I couldn't control what time the bus would come. And the director said, yes, of course, that makes sense. Um, and I had one coworker in particular who was pretty unhappy about the fact that I got to come in 20 minutes or half an hour later than everybody else, even though I made up the time um, by working faster, harder during lunchtime, staying later. And that worked out. But I had to really pull her aside and explain to her why it was equitable for me to come in when I had to come in. It was an accommodation. I also had a coworker who used a wheelchair and had to take public transportation. So again, I made it a point for her to have an accommodation because during rush hour she had too much trouble. The trains were crowded, and people would not be observant of her needs that she had for space for her wheelchair. So that was an accommodation. So I think at this point, I will stop and give someone else to give a chance to talk about that. Thank you.
Thank you, Joan. Letitia, can you tell us how you've experienced inequities both personally and professionally?
Sure. Thank you again. So, wow, I've experienced a lot. So, the biggest thing that comes to mind is the times that I have nearly died due to systemic racism and ableism in the medical field, in which I was not believed that I was in pain. My pain was ignored. I was told that, this is normal, which I was like, make it make sense. How can it be normal? And then also, you're telling me that it's not real, right? And understanding that that is from their lens of the medical model of disability, as well as being a Black queer woman, not having that ability to be listened to led to me nearly dying. And I still have long-term impacts from that of chronic pain. And it took many, many years, over 2 decades, to diagnose me with a chronic progressive illness. So really thinking about, especially in the medical field, how these different attitudes and ways of thinking about people can impact them. And so even in my professional career, before I became my own business owner, right, not being listened to, being told that, oh, she can't do the job because she's not capable, even though, hello, I'm right here, you're talking about me. And often my lived experience and the level of ways that I can think and do and solve a problem was often more valuable, more insightful than those with higher degree levels than I was. So understanding that even within kind of the system in which just because you have some sort of higher degree therefore makes you more valuable, when in my experience that's not actually the case. And so having to prove myself over and over and over again that I am just as smart, just as capable, and sometimes even more capable than those who either had EDDs or PhDs, etc., was something that I was constantly battling against in my professional career. And that access to education was always such a barrier for me personally. So thinking about the ways in which I could have gone up that ladder, that educational ladder, but couldn't due to discrimination, has always been kind of at the forefront of how I do business. So even now, in the ways that I talk about equity, especially when I was leading large equity initiatives, saying, I'm not disabled on Sunday, Black on a Tuesday, and queer on Friday because, hey, it's party time, right? I am all these things all of the time. So you can't separate me into different buckets and thinking that these aren't all connected. And even as someone who is physically disabled with a spinal cord injury, when I educate medical professionals to say that the body is also not disconnected from each other, right? Just because someone can't feel their legs doesn't mean that you don't check their legs to make sure that something's not wrong, right? And that we don't dismiss people on their pain, because we know what that ends up happening is that this leads to higher mortality rates. So I have that lived experience that I can tell them the cause and the long-term impacts of you not doing your due diligence causes harm, right? And so in my advocacy, in my work, really trying to appeal to people that, we don't come into this world trying to do harm to others, but yet end up doing so just because we've internalized so much about each other. And that undoing is part of being liberated, right? And now that I'm on the other side of things, how do I then relate that back to these institutions that I work with to say, this is what happens. This is the human behind the data point that you're talking about. And what can we do differently to change the outcomes and the trajectories of these people that we keep talking about? It's not some abstract, right? This is real life. So that's how I've experienced inequity, but also how I've personally dealt with inequities in my own life, professionally and personally. Thank you so much.
The human behind the data point. I love that. Thank you so much for that, Letitia. Georgina, can you tell us about how you've experienced inequities, both personally and professionally?
Sure. So I mentioned that I'm a developmental behavioral pediatrician, and so I observe a lot of inequity when I'm seeing my patients in clinic. For example, there may be challenges that people have being able to get their psychoeducational evaluations, or a lot of what we deal with is lack of responsiveness from schools when a child has a certain need and that's not being addressed by the schools. So I take that information and really think about professionally in the public health part of my job, how to address some of those. And so, for example, we have the Learn the Signs Act Early program, which attempts to improve health equity by working to close disparities in early identification of developmental disabilities by improving and increasing screening and identification so that all children and families can access the needed services as soon as possible. And some of the ways that we focus on improving equity in this area is by a focus on, for example, lower income families or families with lower levels of education by partnering with programs like WIC, with Early Head Start, home visiting, and subsidized early childcare programs. And then we also have a program called the Autism and Developmental Disabilities Monitoring Network. And that network, the ADAM network, reports prevalence of autism and other developmental disabilities, and also reports on the ages of identification, so that we can highlight the disparities between different population groups, and then we can all work to address those disparities, say in this case, in the time of or the ages of identification, and be able to sort of improve that so that more children are being identified early, so that they can get into the services that they need.
So the next question that we have for all of the panelists, and again, I will call your name in order, is from your perspective and work, what can we do in partnership with people with disabilities and their families to achieve equity? I know that Hector talked about this a bit, that, you know, this is a journey. This is something that a lot of things would need to change in order for us to even make the slightest move toward equity. And so let's first hear from Joan.
The question is, what can we do in partnership with people with disabilities and their families to achieve equity? I think we start with helping them understand, people with disabilities and families and others, the difference between equity and equality, and that equality is not always the standard to use, especially when we want to make sure that people can have a fair shot at achieving their potential. And I would say that most of the families that I know and work with do understand the concept of equity. The trick is to get the balance so that we have a level playing field, and we give a person the supports that he or she needs, so that there is not an unfair advantage, but that we're not unduly protective, and we have to get that balance. We need to seek and encourage inclusion, partnerships, and participation with people with disabilities and families, especially in research and training at all levels, from design through implementation through data collection, and find out what people need for timely access to programs and healthcare and education and social activities across the life course. And then, most important, is to have them help you figure it out. I think everybody gets sick and tired of being told what to do, and this is the way to do it. And we really have to make sure that we have partnerships. And really important in partnerships is to give support and guidance to people who are new at this. A lot of the work that I do, we have some people who have never been on a committee before. And so we want to encourage them to speak up and understand that what they have to say is valuable and that they are a part of the whole process. We also want to work together to avoid negative outcomes that impact people with disabilities, that really impact everyone, but especially people with disabilities, and plan together how to address them. And I'm talking about unmet healthcare needs, unhealthy behaviors and lifestyle, mental health issues, chronic diseases, and other social determinants of poor health. And then we need to really help families and people with disabilities learn about resources and what's available out here and work in partnership to fill in gaps. I can't say how many times I've looked for a particular resource and found it by word of mouth only because I've been insistent on asking the right people. And I think we need to do a lot better. And I don't have the answers here right now, but I know that in partnership we can do that.
Thank you. Letitia, we're going to come to you again to tell us what we can do in partnership with people with disabilities, including obviously from your perspective as someone with lived experience in terms of achieving equity.
Well, first, I think the overall movement needs to just highlight the disability justice principles and really let that be the core of how we drive advocacy. Furthermore, we need more folk who are Black, queer, disabled, brown, disabled in leadership positions, and making sure that those are the voices that we highlight and center. I just had a conversation the other day, and I'm Black, so the other day could be like 2 years ago or 2 weeks ago. So don't worry about that. And that what we need is clear policy decisions, clear policy action that has already been talked about, but yet not to be enacted. And so that becomes a huge barrier. If we're going to be talking about equity, we need to be about it and actually start doing what is necessary, what is right and necessary in order to actually achieve what we profess, right? We can't just be creating tables and programs, etc., when folk are facing real life barriers with SSI, housing, right, Medicaid. These are the things that we need in order to heavily push in order to create the world that we wish and profess to see. So for me, that is really what is at the crux of how we partner. It's, are we actually identifying what the community has already said that it needs? And two, are we actually doing the work in order to make sure that we get what it is that we say that we need? And it's really all that's as simple as I can put it. Thanks so much.
So well stated. Thank you so much. Georgina, we'll hear from you next. What can we do in partnerships with people with disabilities and their families to achieve equity?
So I think, what we can do, or what we've been doing at CDC to think about how to partner with people with disabilities to improve equity in this particular time, is working to ensure that people with disabilities are included and referenced in the guidance as much as possible related to the coronavirus or COVID-19. And this has been one of the first emergency responses where there has been an emphasis to try to create websites with resources that are specific for people with disabilities, working with people with disabilities to try to inform what those resources should be. So for example, we've created many ASL videos to communicate COVID prevention messages, and worked with people in the deaf community to select which messages are going to resonate most, and how to get those videos then out to the people who need them. We're also working with a group of disability partners to increase the knowledge and to increase flu vaccination this season, with the goal of ensuring access and ultimately increased vaccination among for flu among people with disabilities, which will improve health, or has the potential to improve health for people with disabilities, because not only can it decrease hospitalization from flu if you have the flu vaccine, but in this particular time when there are lots of people that are getting very ill, it will give us that opportunity to have more hospital beds available for people who have COVID and need to be hospitalized, or people who have other conditions for hospitalization. But all of these activities that we're doing related to both the flu season this season, as well as the coronavirus or COVID, we're trying to inform this in partnership with people with disabilities and disability organizations to try to make sure that it resonates and gets the messages to the people who need those messages. Thank you.
Georgina. And we will end this round of questions with Hector. Again, what can we do in partnership with people with disabilities and their families to move toward the achievement of equity?
Thank you. So I'm on the board of directors for the National Disability Rights Network up in Washington, D.C. And that's part of my advocacy work. I think this particular question about what to do right now with our communities is just so important. COVID-19 has changed the landscape forever. And a lot of what we have been used to doing before COVID-19, we're finding out it's important to readapt and to modify to how COVID and the civil protests, conversations around racial inequalities have really completely not only changed the landscape, but given us the opportunity to really try a different approach. I think for the longest time, we have been working from the disability community to educate folks, which I think is something that we need to do. But I think oftentimes we are often the one having to do the legwork afterwards. So I think now one of the things that we're really seeing as an important conversation for engaging the disability community and the families and communities in which they live is by really having people understand how disability in COVID has changed so many of us. When we look at, for example, of mental health, which is now one of the most predominant disability issues around the world. Before COVID, I think it was 1 in 5 people experiencing a mental health condition. That has changed now because of COVID. I do not know a single person who has not experienced anxiety, depression, fear, despair, because of COVID and all the other pandemics that are happening around us. So I think we have a prime opportunity to really, educate people, enlist them into the work that we're doing, and really, so it's educating. We educate people. We enlist them to do the work that we do them, because I think it's important to not only have people at the table right now making recommendations, but I think it's important to really have a conversation about the table that we're in. So really redefining and making sure that recognizing that everybody with a disability is actually a bigger group than before, so that we can come up with some really tangible solutions instead of just talking about them.
Thank you so much, each of you, from sharing your perspectives. I'm going to turn things over again to Brittany to lead our last round of questions.
Thank you, Tawara. The theme of our conference is leading the way in achieving equity in the next decade. So we want to close this panel by asking each of you what you'll do in the next 10 years to continue your equity work. Georgina, can you start us off?
Sure, happy to. So there are a number of different things that I can see our work at CDC developing into over these next 10 years. And the examples that I'm going to give are really in 3 different areas: in data, in research and program, and then in telehealth. And so when we think about data, I think we need better data about various types of disabilities and the successes and challenges that people have in healthcare access and transitioning from pediatric to adult healthcare, to know where to focus our programs and where to where people are struggling and where we can ultimately improve health equity or strive for health equity. The second area is really in research and programs, and we need to expand our research to better understand what kinds of programs work well with various populations of people with disabilities. So sometimes there's a program designed for a person without a disability, and that program without adaptation doesn't work for people who are living with disabilities. And so we are committed to work with other CDC programs who work on things like heart disease, diabetes, cancer, and other conditions to include a focus in their research and programs on people with disabilities. And then finally, there's been a lot of focus in the last probably six months or so on telehealth. And I think because of the COVID pandemic. And this has really given us an opportunity to think about how telehealth coverage can be expanded to improve healthcare access. That might be access, sort of beyond this pandemic. It may allow for more patient visits being done this way that can overcome some of those barriers, such as issues with geographic location or sort of rurality, or with transportation barriers. But again, it's really important if we're looking at telehealth that we make sure that the telehealth platforms that are being used, that the methods that are being used are actually accessible for people with disabilities, and that extra step is made so that we really are trying to not just do what people said to make things equal, but actually to achieve health equity. And so those are the three areas, so data, research, and then telehealth are areas that I think we will continue to pursue at CDC to help support health equity among people with disabilities. Thank you.
Thank you, Georgina. All really important points for us to think about as we continue this work. Hector, what will you do in the next 10 years to continue your equity work?
It really goes around the issue of access. I think as we continue to work on surviving, because that's what we're doing, COVID, I think really being a strong advocate, aligning other advocates, elevating younger people and people that are doing intersectional work is going to be very important, especially as we work to rebuild our systems and oftentimes to completely reinvent them. We're going to be able to have great opportunities for more people with disabilities to be providing that input and guiding those decisions. I don't think, and I think many folks have become aware that when it comes to disability leadership and representation, oftentimes people of color are not always leading those conversations, especially when it comes to Latinx, Native American, and Black and African heritage individuals. And within the disability community, we make such a representative part of the community that I think it's very important to change how we are viewed and listened to and are part of the conversations. But I'm also going to try and just live my life as a person with a disability. This last December, I adopted two little babies. I have two toddlers, a 1-year-old and a 2-year-old. And I think I'm going to try to be the best person that I can as a person with a disability and be a dad and raise them and be part of my community as a disabled person, taking care of kids and lead by example. I think that's what I'm going to do. I'm going to invest the next 10 years on the future, and that involves raising the next generation and lifting as many people as I can so that we can move forward.
Thank you, Hector. Leadership of people of color with disabilities and investing in our future is crucial to the future of equity work. Joan, can you tell us about what you'll do in the next 10 years to continue your equity work?
These are some values that I live by and that I plan to continue living by. Number one, that all people with disabilities must be presumed competent. I am particularly talking about people who might talk differently or walk differently or look differently or be a different skin color than everybody else. And we as a society have a tendency to look down on people who are different than us. So we have to presume competence. All that we are all people are recruited and welcomed as members of our community and should fully participate and learn with their peers, and that all people should be able to experience reciprocal social relationships. In addition to that, I want to improve disability competency among families and among allies and professionals and the general public and people with disabilities. I want to increase accessibility of healthcare facilities, and not only the facilities, but their policies, such as examination tables. You'd be shocked at who does not have accessible examination tables. Such as weight scales and other things like that. Um, and I want to increase disability training so that professionals will be better trained as through the life course as people with disabilities age. I think we have a lot of good information for younger and identifying and younger children and people, but with adult services, everything changes. And so that's what I want to work on in the next 10 years. Thank you.
Thank you, Joan. Letitia, can you tell us how you will continue your equity work in the next 10 years?
Oh, wow, no pressure, right? So I think for me, it's all about continuing to do what I have been doing. My existence is resistance. And so thinking about at least from the work that I do, if I could achieve, changes in Medicaid thresholds, if I can get better systems integration, if I can help push for higher income for SSI, because not everyone can work or wants to work and shouldn't have to. If I can help to push for basic universal income, as well as just universal healthcare in general that allows for disabled people to have the kind of choice that is needed for their lives. I think I also have goals about changing the ways in which durable medical equipment is kind of done as a business in general. But how do we have wheelchairs and other mobility aids, et cetera, that aren't rated for in-home use only? I'm not disabled only inside my home. I am allowed to go out into the world. So what would that look like from an equity perspective if that rule was eliminated and we actually had equipment that was actually durable? The irony that it's not right now. Also, really making sure that those who are most impacted are in leadership positions, and making sure that locally that our politicians, elected officials are supporting these types of initiatives, right? It's not just federal law, but at the local level, how do I make where I'm at the best, most accessible that it can be? And if I can achieve those things, I think I will have lived a really, really great life. And I think for my business, also making sure that these are the values that we lead with. And so with every organization that we work with, that they become the most equitable organizations, and that they then impact those that they live with, work with, and are impacted by. So hopefully in the next 10 years, that's what we'll be able to see, and I can be a part of all of that. Thanks so much.
Thank you, Letitia. Please keep existing and resisting. Hector, you talked about equity being a term of restoration and balance. And I thought that was really important. And I wanted to ask you, what does it mean to restore equity and balance among a population that's never really had either of those things in our society, never really had a place in our society?
Just because we haven't had it doesn't mean we weren't born with it. In my family, we talk about equity, for example, about like the water in a stream. The water that is upstream and downstream is still water. It's not less because it's gone away or because we missed it or because it's coming. And I think that's one of the same ways that we look at kind of restoring balance, kind of giving both the upper water and lower water its privilege and its right. I think we as people have been devalued for so long, not just in terms of our rights, but I think sometimes it's almost like saying this person is worth more. Sometimes literally, we still refer to it, this person is worth more than somebody else. It's a degrading way of measuring life and purpose when we all are here existing together. I think somebody mentioned earlier or throughout the presentation about how existence is resistance, and it is, but it shouldn't have to be. Existence really should be balanced, but because we are so devalued, our existence just resonates so much and contrite with whatever is trying to destroy us, that I think we need to really restore that balance as a community and as a society. I think perhaps one of the reasons that we are seeing so many of the struggles and disparities is because of the racial indifferences, that have continued throughout the generations. And now more people are really becoming aware of them. Most of this stuff is new to many of us. Many of us live it on a daily basis. So when people are like, oh my gosh, can you believe this is happening? It's like, yeah, I can, and so I think it's become a time of reckoning, if that's the right word. And usually the way you deal with reckoning is by restoring balance, but it tends to be turbulent, but it's part of a cycle.
Thank you so much for that. I think just as another follow-up, you talked about the origins of equity being a term out of law and commerce, which struck me as a civil rights attorney in particular. And since the theme of this conference, and I think one of the goals of this conference, and Tawara can correct me if I'm wrong, is to sort of develop a framework for equity within this space. How do we reclaim, or how do we save words like this from becoming just jargon?
I love the fact that we have people here who interact with academia and law. I really do that because I think many of us can kind of recognize that we are forced sometimes to use paradigms that are initially not made by us, and they were made to oppress us. I'm a neurochemist, so I work in chemistry, but I like to do a lot of decolonization in my methods. So I think that also applies to how we do justice and civil work. We have to sometimes really recognize whose tools are we really trying to use to dismantle the system? Are we just using the same tools that were used against us to fix the system? And that doesn't really work. Sometimes we have to create different tools. Like I like, for example, how in science we're starting really to use more storytelling, or instead of using qualitative measures, instead of using quantitative measures, we're starting to really find the value in qualitative data, stories and narratives that tell more than what can be measured by numbers. Because it's not an absolute thing, especially when it comes to people. Numbers are great for science, but people are more than that, just like we're more than our issues.
Which goes back to what Letitia said, right? The human, finding the human behind the data point. I love that. Just to sort of connect the discussion a little bit, you also, Hector, talked about the need to elevate voices. And I think that relates to the story Joan was talking about when she said she would tell people to talk to her daughter and not to her, which I think non-disabled people often have a tendency to do when they see disabled people in the company of someone else. So I wondered if we could talk a little bit more about, maybe Joan, you could speak to what it means to you to elevate the voices of people with disabilities and to sort of act as an ally, if you will, since that's language that we're hearing a lot about these days.
Right. I'll give you an example since we were talking about stories. And I love to talk about my daughter. So she's in a group. Some of them don't like being called self-advocates, but some of the allies do call them self-advocates. And they have a very precise way of doing things and understanding one another, which is very strong with respect and elevating leadership. And so everyone in the group who wants to be is an officer. And my daughter definitely wanted to be an officer. So what was decided was that she would be the sergeant at arms, because even though her speech is not easily understood by everybody, she's can be very assertive and can be very loud and very noisy and show that she is the leader. So when meetings start, the first thing she says is everyone slows down, and there are usually 50 or 60 people there. And as meetings start, she will yell into the microphone, "Quiet," and turn off your cell phones. And everybody who doesn't know her gets a big charge out of that, because she is taking over the meeting and she is showing that she's in charge of keeping order in the meeting. So what I'm really getting to is that leadership is so important. And how do we do it? It doesn't mean that you have to be the president of the corporation. You can be a leader in so many different ways and show your abilities and your capabilities in so many different positions. And so that's exactly what they do. So I don't know if I answered the question or not, but
I think you did. I wanted to talk a little bit more about what it meant, what it means specifically as a non-disabled person to insist that society listen to people with disabilities, whether that may be um, not what they're used to, or more complicated than what they might be expecting, or what have you.
oh, well, I think that age and wisdom have gotten me to the point where I really don't accept any foolishness from anybody who doesn't immediately start the conversation with mutual respect. So maybe I'm not a fair person to judge that, but at one point I used to stand by and feel like, well, what can I do to make people understand that that by your ignoring her, you are im- imparting some of your negativity on her and making her feel like less than the rest of us. And then one day, I guess I just became woke and said, we won't do that. And that is exactly how I try to live my life. So
I think
that's
that's
it.
You also said something else that struck me. I don't know if this is in my intro. It should be in my intro, but
She
I'm
said woke. Did that catch you? She said woke. That's pretty neat.
yes, I love that. Yes.
Like
I
some of us longer than others, but we should all strive to be woke. Yes.
hashtag stay woke. Yes.
Stay woke.
So I am disabled. That if it's not in my intro, it should be in my intro. I have cerebral palsy. So when you, Joan, were talking about your daughter's school bus showing up late, and then you get into work late, I immediately flashed back to my own childhood and my mom. And you said something. You said you had to request an accommodation at work so that they knew that when you were late that was why. And I thought about um, first of all, what it means as a non-disabled person or the parent of a disabled person to have to request an accommodation, because that's language that we typically only hear about in the context of the person with the disability. But also, since this is a discussion about equity and what it means and all the different layers, I also thought about the ability to request an accommodation at work requires a certain level of flexibility and privilege if we're going to really talk about it, right? And what that means for people of color with disabilities, people from different socioeconomic status with disabilities who might not be able to have that same flexibility. If you could talk a little bit about that.
Yeah, yeah, yeah. I don't know the answer to that. Um, I know that a lot of work that I've done when I had clients were people who would say, oh no, my job will fire me if I'm late. And they will not understand that. And that, I don't have that kind of flexibility. And I don't know what the answer is, except the fact that people need to be connected with people like you and all of us on the panel, so that they do understand and have the confidence to know that they do have rights and that they need to make it a point to assert those rights. Easier said than done. I will admit that. And I haven't always had jobs where it was easy to say, look, by association, I'm coming in late, not because I was up partying last night, but because I'm waiting for the school bus to pick up my daughter, and I was a single parent. So, and then I had to deal with the backlash of other people who were still standing around talking at 9:15 when I came in. And I would, and I had to tell the director, I come in, I sit down, and I start working. I don't have my, warm up period. I don't go get coffee. I'm sitting here and I'm directed what I do because I'm serious about it. So, how do we get around that? I think that's getting into the big policies of what this country's about, and really getting into equity as well.
Right.
It shouldn't be that somebody who has more education, more money, the right skin color, whatever race, has an easier time of it than other people. But it's true, and it's something that goes on every day, everywhere, and we can see it right in front of us now. So.
Right, thank you. I'm gonna skip to Georgina just because Georgina said she had to go. Georgina, I wanted to ask you, you talked about transitioning from pediatric care to adult care, which I think is something that's so important for people with disabilities and something that I'm experiencing myself. Could you talk more about the work you do around that, data you're seeing around that, what have you?
Yeah, I mean, certainly, there have been many attempts over the last few decades to try to figure out how to successfully transition people in different parts of their lives, but in particular, where we're looking is really in healthcare. So thinking about what, child and adolescent healthcare looks like compared to healthcare as an adult. And part of that is looking at the data. Sort of part of that is seeing do people successfully transition, which we know doesn't happen a lot. So we know that people end up using the emergency departments for a lot of care during that time. There's a lot of issues in either understanding how insurance works, because insurance can change as you transition into adult health care. And so, part of our job at CDC is kind of to describe that problem and then partner with you all, with people in academia and people in disability organizations and with people with disabilities to try to figure out what some of those solutions are. I think we're certainly, all of us are not there yet, right? It's still very challenging to transition to adult health care, but it's something that has to get better, because people fall through the cracks. People's chronic medical conditions get worse, things and that can set you on a trajectory that is not good as you move into a young adulthood. And so I don't think I have the answers yet, but I think it's something that we need to strive really to, like your question just before was, what are we going to do in the next 10 years? I think this is a place that we really all need to focus on, because we're not going to achieve health equity if we can't figure out transition from pediatric to adult healthcare.
Great, thank you so much. And last but not least, my follow-up questions for Letitia. You mentioned systemic racism in the medical field and the medical model of disability. Can you talk about how equity plays into that? What would equity look like in the medical field with respect to people with disabilities?
Well, we would certainly see less deaths as a result of medical neglect. I think that's the first thing that comes to mind. I've lost too many people due to racism and ableism within the medical field and nearly lost my life. So I think that's like the first step, equity would see people actually live happy, healthy lives, as well as seeing that these attitudes that many doctors and other healthcare professionals have, especially towards Black and Brown people, be eliminated. You wouldn't see it in the textbooks. You wouldn't see it in how they actually do business, and that, quote unquote, patient-centered care actually becomes patient-centered care, right? And that you don't bounce from specialist to specialist to specialist with people going, oh, you're too complex. But having doctors really go back to their values of, I got into this work because I wanted to help people. And the way that systemic racism, the medical model, and just the business model of healthcare in this country does not allow for that individualized, personalized, patient-centered care. So that's kind of where I would see how things would change.
Thank you so much. And you also use the words disability justice, which is central to any discussion about equity. So I just wanted to ask you, how does equity fit into disability justice, or does it?
I think it's at the core of disability justice. So disability justice was kind of formed by Sins Invalid, and these are Black, queer, disabled individuals. And this was in response to the disability rights movement, which is a very white-centered, rights-based movement. And as we know, we've already been talking about inequities. So you can't use litigation in a rights-based strategy for all situations and all people, particularly when those strategies lead to access to inequitable systems, right? The legal system, the justice system, et cetera. So really thinking about leadership of the most impacted, we need to elevate those principles of disability justice, inculcate that into the work that we're doing, and really saying, like, are we actually aligned with what this community says is needed as far as developing a strategy that is rooted in disability justice. I had a conversation with Dewey Human a while ago, and we talked about, how we really need to learn more about how racism impacts the disability rights movement, how racism, LGBTQ issues, neurodivergency isn't really included in all of these movements. And then that's how we build cross-movement solidarity. This is how we begin to say, everyone can be multiple disabilities, right? I have multiple disabilities. You've heard it here in this panel. So what does that look like from an equity strategy when everyone is heard, right? That we understand the commonalities between all of us and that we move forward together with one voice. That is when we're going to be able to see real change.
The notion that for this conference this year, because I happen to be chair way before there was COVID in our pandemic, that we needed to focus on equity because it really has not been defined in our space. Whereas health equity is well defined, mental health equity is well defined, even early childhood equity is well defined, and that there is an agenda, and that there's a strategic approach, and that there's efforts and it's highly visible. And so, as we think about that, we need to look at coming up and crafting some way in which we frame equity. I'm very interested in Hector's response, but I just want to share with you some thoughts that, and this is with some tweaking, that equity can be defined as the absence of systematic disparities. Because I think disparities are the product of inequities. And to look at the absence of systematic disparities between social groups that have different levels of underlying social advantage and disadvantage because of their different positions in our social hierarchy. We think of equity as meaning social justice or fairness, and it is an ethical concept, and it's grounded in principles of distributed justice. Now, that is a framework for thinking about equity. It comes from the health equity literature. We've not had a chance to really dig in deep and to look at what can we frame for our own networks, looking across disability groups to help guide us in the next 10 years. Does anyone want to respond to that?
Can I add something to that conversation?
Sure.
You know, I think within the disability community, I think there needs to be perhaps a reckoning about the way racism has played into many of our members in the disability community. I had always believed that poverty was the leading cause of disability worldwide. And I didn't mean just economic poverty or poverty of access to resources, but just poverty as an overreaching concept. Um, that poverty is more significant among, Black, Latino, Native, API communities. And we see that now more than ever in the way that COVID is impacting our communities. We have in the Latinx community the people working as frontline workers and getting sick, getting paid little to no money, getting evicted. And then we have our Black and brown brothers and sisters who are also working and are dealing with life-threatening issues just from stepping outside the door. The added intersectional stress in our communities is just so detrimental that we now have almost an average number of people that die from COVID in our communities of color across the country. And that is just absolutely phenomenally unacceptable. Earlier, we talked about the need to elevate voices of color representation. And I think this is where all of us have to shake our privilege, like me as a cisgender looking male, to try and elevate and educate, not just elevate anybody, but educate and share those voices that need to be heard right now. It's just so important to our survival. We have lost so many people in the disability community to COVID and over the years to systemic racism, that now is really the time to do it, because racism has become the defining health disparity of my time. And it's unbelievable how much money we spend as a society dealing with the consequences, the health, the legal, the socioeconomic consequences of racism. And this racism that was pretty much instigated a long time ago and nobody talked about it, did about it. Nobody wanted to admit that they were benefiting from it. Nobody wanted to say, oh, I need to give up my privilege. No, because it's very comforting sometimes. And I mean, it is comforting sometimes not to have to battle, and speak up. But that's not a privilege that most of us have, especially those of us who have members in our community who are dying. So I don't know if that answered your question, or if I just kind of complain, as some people said, but I'm not complaining. I'm just saying it as it is.
I thank you very much. I thank each of you.
Visual description: AUCD conference logo, 3 figures holding the AUCD globe logo. Text: achieving equity, leading the way in the next decade. Hashtag AUCD2020 Tuesday Plenary, leading change to achieve equity. Conversations we need to have. Visual description: smiling Black woman with chin-length black hair in twists. Brown eyes. She is wearing a red sweater and large necklace. Text: Tawara Good, Director, National Center for Cultural Competence, NCCC at GUCCHD. Visual description: smiling white woman with short brown hair. She's wearing glasses, a tan sweater, and a multicolored scarf. Text: Joan Beasley, Director, Center for START Services.
We just heard from an amazing panel who shared their lived experience and insights on what it will take to achieve equity for people with disabilities. Now, let us shift to a population focus. We know that people with intellectual and developmental disabilities who have mental health needs experience inequities at disproportionate rates in the US, territories, and tribal nations. I can think of no one more qualified and more passionate to really talk about what it will take to achieve equity for individuals with intellectual and developmental disabilities, and mental health needs, really looking at that within the context of the communities in which they live. And so I would like for Joan Beasley to join us in this panel.
Hi, thank you, Tuara, and thank you to the wonderful panel. The question is a very important one. And actually the first thing my first thought when you asked that question was, well, why are you asking me? The people we should be asking are people with intellectual disabilities and developmental disabilities and mental health needs, and have more of a dialogue with them. So I think that is the first step, is to really listen and pay attention to who they are, and to remember that having an intellectual and developmental disability does not devalue your ability to have input and have your own voice. I don't need to speak for them. I need to speak from my own perspective around inequity. And the reason why I have one is because I've been doing this work for about 35 years now in trying to promote equity as a mental health clinician. I learned a long time ago that people with intellectual disabilities were underestimated and dismissed as not really having emotions, never mind emotional needs. They literally were thought of as people not capable of having emotions. Imagine that. And there's still a stigma and there's still bias associated with intellectual and developmental disabilities that discounts the emotional wealth and resources of people who have different cognitive abilities. And so it's very important, in order to promote equity, to first acknowledge that their humanity is just as valuable as anybody else's. And I think of the acronym that Marty Seligman created for positive psychology called PERMA. It stands for positive emotions, engagement, relationships, meaning, and accomplishment. And while we've done really great work in the field of disabilities for many people to promote equity in these areas, for people with intellectual and developmental disabilities who have mental health needs, they have lagged behind in terms of disparity. Disparity can't be accomplished without equity. And equity really requires that we view people in a way that's more open to them and more accepting. So I think it's really important. It's a big demonstration of the challenges that we face to look at one of the most stigmatized groups in the disability world, which is people with intellectual and developmental disabilities and mental health needs. I just want to add one more thing to this contribution, and that is, there's a lot of research and study about the high prevalence of mental health needs in people with intellectual and developmental disabilities. Many studies show that as high as 60% of the population have mental health needs. I've been very curious in my career as to wonder why. Why is this so? And I think we underestimate the impact of trauma, exclusion, and inequity on the emotional well-being of people with developmental disabilities. It is that inequity which actually creates the opportunity to develop mental health conditions. So if we're really going to fight for better treatment of people with mental health needs, we have to fight to create equity that creates opportunities to reduce the despair they suffer from because of our societal stigma and barriers that are created for this population of people. They have just as much value, light, joy, humor as anybody else. And I'm really happy to have this opportunity to say this to all of you today.
So thank you so much, Joni. I know I should say Dr. Beasley, but I am seeing Joni in this recording. As you think about the theme of this conference and achieving equity in the next decade, what are some concrete kinds of things that you would like to see happen within within our AUCD network, and then, quite frankly, across the country?
So I think AUCD in our network, so in mental health, the way people are treated is if you're suspected of having a mental health condition, you get a diagnosis and then you get a treatment plan. If you have IDD, you get a management and control plan. So you're evaluated for how you can be managed and controlled. So the first thing we need to do is to neutralize that and look at what are the barriers to good diagnosis? What are the barriers to effective treatment? So I think there's sort of a double edge to this. The network and all of our partners need to work on better mechanisms to promote well-being, emotional well-being in the population as a whole. And when they have mental health conditions, to get them the best and most evidence-based diagnostic and treatment planning that they can get, just like everybody else, just like you would want for anybody in your family.
All right. And as we think about that, are there any policies or any resource allocations or other things that you would like to see happen?
Well, at AUCD, I would love to see a promotion of mental health and emotional well-being as a separate and distinct mission of the organization. I don't think that emotional well-being is front and center enough. I don't think that mental health treatment is the same as behavior management, and the two should be distinguished from each other. As an organization, I think we can do more to take care of that. There should be more funding for inclusive research on methods that work, that include the voice of people with IDD, so that they can speak for themselves to let people know what their needs are and what they benefit from. One thing that we're currently working on with the National Research Consortium is to convert the VIA Institute Strength Survey into a plain language survey so that people with IDD can take a survey to identify their character strengths, which is a very powerful tool, rather than just always looking for mechanisms to identify what's wrong with you, to really promote what's strong with you. So I think we can all have a better dialogue about that. The other thing that I think is very important to recognize is that there's an intersectionality between race and cultural issues that actually weigh down this discrimination that people experience in MHIDD. If you're a Black man who's autistic and nonverbal and having mental health issues in the community, and you're disruptive and disturbing in the community, it is more likely that you will be shot than if you're a white man. And having autism certainly doesn't help. But Black males who have IDD are at great risk. And we have found in our research that while many people end up in the emergency room with IDD, disproportionate numbers of people who are Black are chemically and physically restrained in the emergency room, regardless of their presentation, when you control for their presentation. So I think one of the other things that we need to look at when we look at inequities in MHIDD is we need to look at inequities in all of humanity. And when you stigmatize one group, it actually exacerbates all the stigmatization that occurs for groups as a whole. And there's a great intersection to address.
Okay. Thank you so much. Are there any parting words you'd like to share with us going forward?
Well, first of all, it's always wonderful to talk to you, Tawara. And that's a parting word I'd like to share. And the other thing is that I just want to share that there is so much joy in allowing people to be included. You know, this whole discussion about equity and the promotion of equity, we're really talking about the enrichment of humanity. You know, we're not doing anybody any favors by allowing them to be themselves. We're actually doing ourselves a favor by being able to benefit from who they are. And I think that's very important. We're not doing this for anybody but humankind, and we're members, you know? So I think that rich experience of promoting equity actually feeds us, feeds all of us.
Thank you so much.
Thank you for taking part in the second plenary. We hope you enjoyed. We will see you again in the third plenary. Visual description: 3 figures holding the AUCD globe. Text: thank you for watching. Hashtag AUCD2020, achieving equity, leading the way in the next decade.